Good afternoon. Welcome to the press briefing. Before again, I just want to ask our team, I know we were having a few technical difficulties. Clint's giving me 2 thumbs up, so we are broadcasting. Thanks all for your patience and thanks for tuning in. Well, we've continued to make COVID-related announcements in recent weeks. This is our first COVID press briefing of 2021, and we're pleased to be having it as our numbers continue as a state to trend in the right direction. Since mid-November, when our numbers peaked and we implemented additional mitigation protocols, our active cases have dropped by over 80%. From 10,224 all the way down to 1,675. Our hospitalizations, which were of grave concern at that time, have dropped by 74% down to 88 hospitalizations today related to COVID. And our 14-day positivity rate is roughly 1/4 of what it was back in November. It's at 4.13 today. That's the lowest it's been since late August. And according to Johns Hopkins University reporting on COVID, our 7-day positivity rate is now the 4th lowest in the entire nation at 4.7%. For us to be in this fortunate position today against a backdrop of record COVID deaths, record COVID hospitalizations, and record COVID cases in the United States, we are deeply grateful for where we are today for each and every North Dakotan who has done their part to help bring these numbers down and to save lives and livelihoods. Those of you that tuned into the State of the State know that we led with gratitude for our healthcare workers, all those on the front lines, whether local public health, whether it's in long-term care, our first responders, and even those that work in the memorial funeral home services where they've had so much contact with those grieving families. And so again, we're grateful for all of those that have been on the front lines. They've seen the suffering and they've been dedicating themselves and putting themselves at risk to help save our friends, our neighbors, and our families. So we're grateful for all of them. But we're grateful for all of you and your part in helping to drive these numbers down, because it's taken an entire, not just whole of government, but whole of state approach. And we have talked about and will continue to talk about the strategy that we have to help us make it to the finish line with COVID. And this is our 3-pronged approach to eradicate the virus and to return to normal. Number 1 on that is safe and effective vaccines. And we'll have an update today from Molly Howell, the North Dakota Department of Health Immunization Program Manager. She's spoken from these podiums before and has got a great update for us. Second, leg of that 3-pronged approach is rapid tests and rapid tests as in get your results in 15 minutes. That can help identify the asymptomatic cases, meaning those without symptoms, and break the chain of transmission. And the third prong of our strategy to help us get to the finish line and really save lives and save hospital capacity is to make sure that we're making full use of the effective therapeutics that can drastically reduce the severity of this disease and improve survival rates. And here today to talk about that leg of our strategy is Dr. Josh Ranum from West River Health Services and the VP of the North Dakota Medical Association. But let's talk a little bit about where we stand right now. Among the 50 states in the nation, we are number 1 in the percentage of vaccinations that have been administered as a percent of those that we have received at 68%. So these shipments come from the federal government. They arrive at our distribution center in lots of sometimes 975. We break them down. We get them out as quickly as possible. We get them to healthcare providers and pharmacies and long-term care facilities and get them into people's arms where they can begin helping create that broad-based community immunity that we need to help us get to the finish line. And certainly, given the priority order that we're putting these out in, those will help save lives. We're number 4 in the first doses administered per capita. And again, we've got 52,433 doses were administered as of yesterday. So again, I want to share gratitude and give a shout out to Molly and her team and everybody on the front lines that are administering these doses, everybody in the distribution center. This is definitely a leaderboard that we want to stay at the top of, and our team has been preparing for this since September. Now the vaccines are arriving and we're executing well. So go Team ND, let's keep it up. But again, as we think about those three-pronged approaches, safe and effective vaccines, the rapid testing, broadly using those as for surveillance, and then the effective therapeutics, surrounding all of that, surrounding those three strategies is the overarching common sense, proven steps that can help prevent you from getting COVID and or help you from spreading COVID. And that's the simple measures that we can all do and that many of you have been doing to not get COVID in the first place. And that's when you're stay 6 feet apart whenever you can. If you're unable to stay 6 feet apart, then wear a mask. And of course, wash your hands regularly and to stay home if you're sick. But these first three, physical distancing, wearing a mask, and washing your hands, we do that even if you're feeling completely healthy, because again, one of the challenges of COVID, which we now fully understand, is that this can be spread by people that have no symptoms. These simple measures are the lowest cost and most fiscally conservative things we can do to help prevent the spread. And you'd say, why fiscally conservative? Well, if we do this, then we can avoid hospitalizations, which have our medical system is filled and supported with taxpayer dollars. The testing efforts that we were doing, which were filled with taxpayer dollars, even with great federal support. But these are ways where we can be common sense, practical, smart North Dakotans and do it in a way where we keep our costs down and break the chain of transmission. So our fight is far from over, but we certainly can see the light at the end of the tunnel from here. And now we've got these three powerful tools that we didn't even have last fall. And again, those tools being the vaccines, the rapid tests, and the therapeutics. So I would just say, make no mistake, even though we've got incredible numbers and we're in such grateful to be in such a fortunate position to have North Dakota's numbers be so fantastically great at a time when they're heading in the opposite direction virtually everywhere else in the country. So this emergency is not over. And again, I would just take a moment to say that there is some legislation being considered that would essentially try to eliminate the fact that we're in emergency status right now. And I think it's for every practical North Dakotan knows that you would never cancel, quote, a flood emergency in the middle of a flood just because you might have had a slight, dip in the peak because you don't know if the floodwaters are going to go up or going down until they do. And likewise, we shouldn't expect that this virus just to let up because someone may want to cancel the emergency, thinking that that might help us get back to normal. The way we get back to normal is we execute against the three strategies that we have, and we continue to do that in collaboration with local and local political subdivisions and the federal government. Currently, right now, in spite of the great numbers we have in North Dakota, and as I talked about the national situation, the COVID emergencies remain in effect for 49 of 50 states. It would be 50 out of 50 if that one state hadn't put a restriction on it, because they obviously are still in an emergency status. The federal government has been in emergency status since President Trump declared that last March, and the new administration intends to continue that federal emergency effective next Tuesday afternoon. Governor Ranum in South Dakota recently extended South Dakota's COVID-19 emergency for 180 days till June 30th, 2021. And in our neighbor Minnesota, Governor Walz, where they do have restrictions on emergency declarations lasting only 30 days at a time, he has just renewed theirs for the 10th time. During our call on Tuesday with the White House Coronavirus Task Force, Vice President Pence, who continues to stay focused and work hard at the helm of this task force, helping governors of both parties around the country with the important strategies we've talked about, they expect, again, the national COVID-19 emergency will be extended again past January 20th. And of course, yesterday we had a briefing through the National Governors Association with the nation's governors, and last night then that plan was announced by President-elect Biden, a $1.9 trillion COVID rescue plan, which again is being distributed in part to those states that are participating in this emergency. Nationally, COVID deaths climbed to a single-day record of 4,327 deaths on Tuesday nationally. On Tuesday, that's higher than at any point in time during the pandemic, and any time even including last spring. And also, according to Johns Hopkins, hospitalizations nationally are at a record high. And we know from our own experience that the virus does not respect the borders, and North Dakota is not immune to future surges. In fact, the more contagious strain of virus that's been detected in Minnesota, Sanford Health's chief medical officer assumes it is already in North Dakota, and there was a report out today that said that more infectious strain could represent the majority of cases in the United States as early as March. In the White House's weekly report, in spite of these improving numbers, and we're looking very good relative to all other states, but relative to where you'd like to be in terms of cases, we would like to have far less cases, and we remain in the red zone for new cases per 100,000 population. But again, there's only 3 states that are doing better than us in that category, but we're not yet where we need to be. And while hospitalizations are down considerably since November, they did increase this week. We got to a low of 69. On January 10th. They've climbed back up to 88 today. And we did have a reprieve where we had a few days with 0 deaths, which was always fantastic to see. We have reported 8 deaths each of the last 2 days. And as always, our hearts go out to the family and friends of these 16 families who've lost a loved one, as well as all of those who've lost a loved one during the COVID-19 pandemic. North Dakota college students are coming back from their midwinter break, and they're doing that right about now. They've returned to campuses for classes, and also, as we're excited to see that most junior high and K-12 schools are returning this month to in-person learning, some of those next week, some of those in our largest metro areas. So we strongly support in-person learning, but while we have more college students, 45,000 of them back in our state, and K-12 returning to in-person, those represent risks for increases in transmissible moments. There's also been discussion in recent days among the legislature about emergency declarations, and I just want to spend a second on that to explain that these are not, emergency declarations aren't the personal preference of any governor in our nation. They're part of a long-standing national process for how states apply for and gain access to federal funds and resources. And those resources often pass through directly not only to the state, but to local political subdivisions in an emergency. We see this all the time in how we file for and get approved at the presidential level for emergencies related to floods and storms that, again, create an opportunity for us as a state and local political subdivisions to apply for and receive FEMA funding. The discussions right now that are the idea that somehow ending North Dakota's COVID emergency declaration in the middle of this national economic crisis and pandemic, it's an absurd idea. It'll produce many unintended consequences, including jeopardizing the state's ability to access federal funding, relief, and resources such as PPE and testing supplies. And even when we were at our crunch in November with the Department of Defense nurses that came to North Dakota, it's unlikely that those would have been moved to any state that was advertising that they felt there wasn't an emergency going on. So in turn, the lack of this breaking of this long-standing procedure and process for federal and state and local partnerships during emergency, it would jeopardize the health and the safety of the citizens in our economy. Another area where emergency declarations matter is with funding for our National Guard. And our National Guard, we gave them a shout out during the State of the State as well, because today we still have over 300 volunteers from our National Guard. These are individuals who have full-time jobs and families who are volunteering to be part of a force which has been assisting us with testing and vaccinations and all manner of other things to help us navigate through this. Our emergency authority maintains the flexibility needed to implement and update protocols to ensure that we can continue to protect the most vulnerable, keep our schools and our economy open as we continue to focus on rolling out the safe and extraordinarily effective vaccines. But with that as background, that we need to maintain our emergency status, it gives us, having it in place, gives us the flexibility to make the two announcements we're making today. That combined with the fact that we've had such great participation on the protocols by citizens of our state. So today we're utilizing that flexibility and authority we have to allow the statewide mask mandate to expire at 8 a.m. on Monday, January 18th, as it was previously scheduled. I want to just say on this point, we still strongly support mask wearing as part of the important work that we need to do to contain this virus and to maintain the strong position that we're in. Cities, counties, school districts, and others have the opportunity to retain their local mask requirements and keep them in place. And the state supports those locally enacted protocols and strongly encourages North Dakotans, as we have throughout this entire pandemic, to exercise their individual responsibility and mask when physical distancing is not possible. In addition to the cities, counties, and school districts and businesses that have every opportunity to put in protocols related to health safety in their organizations, we also know that we learned this last year, and as we've known how important sports is to those of us in the state, whether they're student athletes or parents or grandparents. And we have a number of tournaments that are happening every weekend with traveling teams that may be coming from other states that have higher percent positives than we do. So again, we certainly encourage the athletic organizations in our state to continue to implement common sense, smart protocols like masking at events, because this is the thing that's going to allow us to keep not only our kids in school, but our teams on the court and allow us to continue to look forward to those state tournaments that we all hope to be able to hold this year. So as I was saying, we must remain vigilant. The second announcement that we're making is that we're changing our business capacity limits from requirements to guidelines, which is a reflection, again, of the lower COVID numbers that we're seeing across the state. And so these requirements will be in the North Dakota Smart Restart guidelines. This means that our state will remain at moderate risk, so we'll remain at yellow for all counties in the state for the moment. But again, moving those from requirements to guidelines, which means that we'll be updating and rescinding an executive order which made those requirements, and the rescinding of that executive order will take effect concurrently with the 8 a.m. Monday, January 18th mask mandate being lifted. So with that, we want to talk about vaccines and some other numbers. And while we've administered over 52,000 doses of vaccine, let's remind ourselves that in North Dakota, we have, as a state, one of the highest populations in the country demographically of citizens over age 65. We also have, unfortunately, a high population of people in our state that have underlying health conditions, whether that be obesity, whether that be diabetes, or many other underlying conditions. So the combination of that is that we truly do have a significant portion of our state which is vulnerable. As we move through the vaccine priority list, again, our goal, of course, is to try to make sure that we get vaccines eventually to everybody over age 65, and certainly everybody over 65 with underlying conditions. But we've got a long way to go, because a portion of those 52,000 doses we've administered have gone to healthcare workers, and the majority of those are often far below age 65. So the effort that we put in place is not indefinite. The three prongs of the stool that we're talking about, vaccines, surveillance testing, and therapeutics, all wrapped with the common sense protocols and individual responsibility. This is not a forever ask of the citizens in North Dakota. We are now months away from having the capacity to be able to vaccinate a significant portion of our state. So the day will come, and it will be in 2021, when we can take off our masks and we can throw them away with confidence. We take them off for the very last time. But we can only do that if we do what needs to be done today to keep ourselves, our families, and our communities and our country safe. And that includes the focus on the vaccine, surveillance testing, and therapeutics, and all of us utilizing the common sense protocols and individual responsibility. So next, I want to briefly walk through what we're watching. And as I mentioned earlier, the 1,675 active cases in the state and 88 individuals currently hospitalized. We have now completed over 1.4 million tests, and over close to 390,000 individual North Dakotans have been tested at least one time, and that's resulted in now over 96,000 positive cases in North Dakota. About 1 in 8 North Dakotans have contracted COVID. So this has been a widespread disease. Fortunately, we've seen 92,551 individuals recover, and sadly, as I stated earlier, 1,373 individuals who have passed away. When we take a look at where we stand in the region, the cases in the upper Midwest, this was this COVID storm that was going through the northern plains states during October, November, and early December. They continue to decline. But when we look around at the case numbers around the region, from 44,000 cases in Illinois to 21,000 in Wisconsin, over 12,000 in Minnesota, about 2,400 in South Dakota, and 3,400 in Montana. We are fortunate to have the lowest number of cases in that region. And we look at positivity rate. North Dakota has the lowest 7-day rolling average at 4.7%, also in the region. So these are all very positive things. But we know this time of year that lots of our friends and loved ones travel to warmer climates, and while the numbers may be declining in our immediate neighborhood in the northern plains, they are climbing, in some cases climbing rapidly in other parts of the country. Arizona has climbed to a positivity rate of 14.7%. Florida is closing in on 12%. And so again, as the virus moves around, and particularly this new, perhaps more contagious strain, we have to continue to be, again, very vigilant about North Dakota, because we're not living in isolation. The actions we take here are affected by those that travel to our state, including our loved ones that may be returning from warmer areas. The statewide 14-day rolling average today is down to 4.1%, and it's leveled out in recent weeks. It did not continue to drop. And so, again, as we we were happy to see that this remained flat, because there was some concern about a post-January, post-New Year's bump. Some states have certainly seen that. We have not seen that here. So again, kudos to North Dakotans for celebrating the holidays safely and smartly. When we take a look at counties, we have every county in North Dakota has an active case, except Oliver and Slope counties. And 4 counties in North Dakota have case counts higher than 100. Those would be our four most populous counties. Cass has 342 cases, Burley 204, Grand Forks 147, and Ward 160. And then there's another 4 counties with case counts above 50, and that would be Williams, Morton, Rolette, and Stark. When we take a look at cases per 10,000, so looking at this per population, the prevalence of COVID-19 in our communities has evened out somewhat across the state, which is positive. And we've got a few hot spots. The Golden Valley numbers there reflect a outbreak in a long-term care facility. Next up, we're going to talk about the vaccine update. And as we've talked about on the three-pronged approach that we have, our strategy for getting to the finish line and putting COVID behind us, vaccines is one of those important pillars. And safe and effective vaccines are here, and they're a key component of how we move back to normal. The groundbreaking cooperation between leading medical experts here in America and pharmaceutical companies around the globe will make this return to normal possible. Thank you, thankfully, to these vaccines. And as we've talked about, some of the production of the key components of those vaccines is happening right here in North Dakota. As a matter of fact, it is for both Moderna and Pfizer. Every phase of every trial was rigorously reviewed and approved by the safety panel at FDA. The process was completely transparent. It was rigorous throughout with continual oversight and approval. And so we're fortunate to be in the position we are today. As I said earlier, we're doing a great job in getting vaccines that the small allocations we're receiving, we're getting them into people's arms. But here to give you an update on vaccines is Molly Howell, who's the Immunization Program Manager at the North Dakota Department of Health. Thank you, Molly, for the great work you and your team are doing, and thanks for being here to give us an update.
Thank you, Governor Burgum. As of yesterday, we have received 76,275 COVID vaccine doses in North Dakota. All of those, as soon as they're allocated to the state, are distributed and ordered on behalf of providers. As of this morning, 69% of those doses have already been administered. Most of the doses that have not been administered are second doses, and so people are just waiting for their interval to be met between the first and second doses. Of the doses that have not been administered, only 5,458 doses are actually available to North Dakotans for first doses. So vaccine is extremely limited in the state of North Dakota. I do want to thank North Dakota healthcare providers, pharmacies, local public health for getting the doses out as soon as we receive them. We have been consistently in the top 3 states for the greatest percentage of doses administered. But we do continue to be allocated less than 10,000 first doses a week. And so people do need to be patient waiting for vaccination. We do have an ethics committee, and our priority groups and phases are posted on our Department of Health website, and we are sticking with those priority groups. Last week, we informed providers that they could transition to Phase 1B, which starts with people 75 and older. I will say you will still see people vaccinating in Phase 1A, so there are still healthcare providers that need to be vaccinated. I think most long-term cares will be done next week. And then after 75 and older, we'll continue moving down the list. Phase 1B includes about 230,000 North Dakotans, and so with 10,000 doses a week, it will take quite a while to get through that phase. So again, we want people to be patient, but vigilant and looking around at local media and healthcare providers and information that's being put out about vaccine availability. Earlier this week, we did post a vaccine locator to our website, and so the public can look up by city and county where they can access vaccine if they're interested in which priority group different providers are vaccinating. And so we encourage people to go to our website to look at that vaccine locator. There was some confusion this week as Health and Human Services did encourage states to open it up to everybody 65 and older, but due to the limited supplies of vaccine in North Dakota, we really can't open it that wide. That's over 100,000 North Dakotans, and right now, as I said, we have just over 5,000 doses, so we are sticking with our priority groups, but everyone 65 and older is in phase 1B, and so we will get to you eventually. Otherwise, for people with our vaccine locator, if anyone has trouble using the internet or doesn't have access to a computer or internet, you can call our hotline and they'll assist you walking through the vaccine locator and helping you find vaccine in your local area. And our hotline phone number is 866-207-2880. I do want to remind everyone, if you are vaccinated, that you need to continue, or we still recommend that you wear a mask, that you practice social distancing. If you're exposed, that you continue to quarantine. And really, you need 2 doses, and it takes a week to 2 weeks after even the second dose to get to that 95% efficacy rate. And so it's important that people continue to practice their prevention efforts. And I know for the most part, a lot of people are very interested in this vaccine right now. We're receiving a lot of calls. Providers are receiving a lot of calls. But I know some people still have a lot of questions about the vaccine. And we want to make sure people are weighing the risks of COVID disease with the benefits and risks of vaccination. And so for risks of disease, 1 in 600 North Dakotans have unfortunately passed away due to COVID. 1 in 215 have been hospitalized. 1 in 8 have had COVID. And we don't know what the long-term effects of COVID are going to be. We're hearing of impacts on the lungs, on the heart, and then also there's the potential to spread COVID to loved ones. Where the vaccine, we have a high protection rate. It's looking like 94, 95%. It may prevent transmission to others. There was some clinical trial data on the Moderna clinical trial that showed it reduced asymptomatic cases by 2/3. And it's our best way to get back to normal. These vaccines will have some side effects. People are reporting fever, headache, muscle pain, joint pain, but they only last 1 to 2 days. And then, of course, I know it's been in the media about severe allergic reactions. CDC is reporting that rate at 11.1 cases per 1 million doses administered. And so severe allergic reactions are very rare, and most and all have recovered after having a severe allergic reaction. And so to learn more about COVID vaccine, I encourage people to go to CDC's website or the Department of Health website. And specifically, if you have questions, we have a really good FAQ on our website, and so hopefully most of the questions are answered on there. And again, I just want to reiterate, be patient, but be vigilant looking at local information and local media. We eventually will get to everybody in every priority group. We're not going to miss you, but we do have very limited supplies of vaccine. So to put it in perspective, we're thinking the 75 and older age group will likely even take probably a month to vaccinate everyone who wants to be vaccinated with 1 dose. That's all I had. Thank you.
Thank you, Molly. And Molly will be here for questions after we conclude the briefing. And again, as Molly stated, getting vaccinated is not just for you. It certainly does protect you, but if it helps break the chain of transmission, and if it would then help keep your family, your community, your loved ones, and any vulnerable people around you healthy and safe. And so, again, we're so fortunate that we have a vaccine that at 95% efficacy is so extraordinarily effective at protecting you and your loved ones from the virus. And by getting vaccinated, if you think about it as another way that you can be part of the solution, you can help, get our economy back open and keep it open. You can prevent more illnesses and deaths, and you can help be part of the team that's eliminating and eradicating this pandemic. So thank you to everybody who stepped up to be vaccinated, and thanks to all those that are doing such a great job to keep us at the top of the leaderboard in terms of getting the vaccine we're receiving into people's arms. The next topic is therapeutics, which is another tool we didn't have last fall, and these are life-saving and game-changing. And here to explain this life-saving treatment, we're pleased to welcome back to the briefing Dr. Joshua Ranum. As I described before, Dr. Ranum grew up in rural southwestern North Dakota in the town of Scranton, not far from where he practices today in Hettinger. And after completing his residency, he returned to North Dakota in 2012. He's been actively practicing as an internal medicine physician at West River Health Services in Hettinger. It's one of our best staffed and most highly utilized rural health locations in the state and perhaps in the region, because I know they bring in lots of patients from South Dakota and Montana and sometimes even Wyoming into Hettinger. He currently serves as the vice president of the North Dakota Medical Association, and he's a fellow of the American College of Physicians. In recent weeks, Dr. Ranum has been instrumental in providing the subject matter expertise and promoting and increasing awareness about life-saving monoclonal antibody therapies with the Vulnerable Population Protection Team and the Vulnerable Population Protection Plan here at the state of North Dakota. When they're administered early on, these, and early meaning after you test positive but you're still well, and long before you would ever hit the emergency room, when they're administered early on, these effective therapeutic options have been proven to dramatically reduce the need for hospitalization, which means that you, by getting these, avoid having a serious course of COVID and could have a much milder course of COVID. It might save your life, but it also preserves hospital capacity and can also reduce mortality among our most vulnerable populations. So just incredible things happening on this front. And thank you, Dr. Ranum, for your work in saving lives. Thanks for your work on helping to educate the state on this key strategy. And thanks for being us today to further discuss these incredible new tools. Dr. Ranum.
Thank you, Governor Burgum. I'm very excited today to speak about two significant advancements in our fight against COVID-19, monoclonal antibodies and vaccination. June 1942. The British are still reeling from the battles of Britain and Dunkirk. The Americans have surrendered the Philippines. Rommel is racing across North Africa. The outcome of World War II is far from certain, something that's difficult to appreciate now nearly 80 years later. However, in that month, June of 1942, the tide shifted in favor of the Allies with a decisive victory at a previously unheard of Pacific atoll, Midway. The fight against COVID-19 has engulfed the world in a similar fashion. More Americans have perished from COVID-19 than they did in the entirety of World War II. Like the Battle of Midway, though, new therapeutics are poised to alter the course of the battle. Bamlanivimab and casirivimab are two of the newest weapons in the treatment of COVID-19. These are very exciting developments as they allow us to bring the fight to COVID early in the disease. They've basically allowed us to go from playing defense to playing offense in the fight against COVID-19. Now, what is a monoclonal antibody? This is a lab-derived protein that has a single target. Its only function is to identify and lock onto the spike protein of the coronavirus molecule. This is very similar in fashion to convalescent plasma, which was used early in the disease and is still used. These antibodies, when administered intravenously, it's a single IV infusion done over the course of an hour with an hour of monitoring for side effects afterwards. Once in the body, it identifies circulating coronavirus, binds to it, and targets it for elimination by our immune system. These can dramatically reduce the viral load in the body. Less virus, less disease activity, less severe illness. One way to conceptualize these is it basically gives our body's immune system a head start. So if I were to be infected with COVID, I would be making similar antibodies targeted against the spike protein and other parts of the coronavirus molecule. My immune system targets the coronavirus, eliminates it, and I hopefully get over my disease. When used in high-risk patients, this basically gives their immune system that head start, buying them critical time for their own natural immune system to make antibodies and fight the disease. As Governor Burgum alluded to, these medications have shown significant reductions in severity of illness and hospitalizations. Untreated, roughly 10% of COVID-positive patients are winding up in the hospital. Only 3.5% of North Dakotans who've been treated have ended up in the hospital, which is over a 60% reduction in hospitalization. And actually, some of the new numbers that are even coming out now are showing much better hospitalization rates, down as low as 2% in some series. It's not only a reduction in hospitalizations, there's a significant reduction in severity of illness as well. State officials have distributed these antibodies across the state, and almost all hospitals in North Dakota are ready to infuse these medications to eligible patients. I'm pleased to report that our utilization of these life-saving therapies has increased significantly over the last week. Across the state, about 400 doses were administered over the first 5 weeks after these medications were released. In just the last week, over 700 doses were administered. This increase is due to several factors. First of all, the slow adoption of these therapeutics was nationwide. A Wall Street Journal article in December highlighted this. Apparently, there was a national NBC News story today as well that highlighted the difficulties in getting these therapies to patients. There were also several regulatory and logistical hurdles that were overcome, and utilization has increased. The Department of Health has focused on both clinician and patient awareness of these life-saving strategies. There's been so much science coming out regarding COVID that it's been difficult to keep up with all of the changes, even for those of us who deal with this every day. It's like drinking water from a fire hose. The department has created an easy-to-follow algorithm to get clinicians thinking about monoclonal antibodies with a COVID-positive patient. There's a list of infusion centers, as well as a staffed call center to help connect clinicians to an available infusion center. There's also been a significant public education campaign. At times, there's a disconnect between a patient receiving a positive test and a clinician being notified of that test. Mass testing events, although important, was one area where there was a potential gap in notification. To eliminate these gaps, the Department of Health has updated the case investigator scripting to assess eligibility for antibodies, and they've also curated an excellent "What to Do If You're Positive" section of their website. We want at-risk patients, or those who think they may be at risk, to speak with a healthcare provider if they've tested positive for COVID. Who is high risk? From the early stages of the disease, it's been clear that certain groups are at much higher risk of severe illness and death. Age is a major risk factor, as are other chronic medical conditions like diabetes, hypertension, cardiovascular disease, and obesity. Bamlanivimab and casirivimab have received an emergency use authorization from the FDA for patients above the age of 12 and above the weight of 88 pounds. As you can see in the algorithm, it's very well defined who meets eligibility criteria. For ages 12 and older, certain chronic medical conditions are needed to be considered high risk. At age 65 and above, a positive test, mild to moderate symptoms, and a pulse are all that's needed to qualify. On the bottom of the algorithm, there's a phone number that patients can call if they have tested positive and need assistance connecting with an infusion center. While not a cure for COVID-19, these antibody infusions can shift the advantage back in favor of the patient. I believe that the addition of monoclonal antibodies to our list of treatment options will be a turning point, along with vaccination, in our fight against COVID-19. During World War II, the Allied powers fought with a single goal: total victory. This is in stark contrast to the bureaucratic backseat driving of the Vietnam War and the subsequent bitterness of that unresolved conflict. The great military leader, Colonel David Hackworth, said, "It's human nature to start taking things for granted again when danger isn't banging loudly on the door." We must continue the battle with COVID-19 with the same aggressiveness of our greatest generation. Vaccination is our only way of reliably achieving herd immunity and getting to a new post-COVID baseline, a point where our schools, churches, businesses, and community centers are fully open, where social events and family gatherings can resume. The new vaccines are incredibly safe and highly effective. As I've said before, these new vaccines are designed to cause your body to produce spike proteins, which mimic the coronavirus molecule. Anything the spike protein can do, the coronavirus can do better. So we want to get that immune response with a small portion of the molecule, not the actual disease itself. They're safe and highly effective. There were 11 cases of anaphylaxis in the first 1 million doses of vaccine administered, a statistic which Molly referenced. That's about 1.1 case per 100,000 patients. That's much less than the rate of things that we don't think twice about consuming: shrimp, peanuts, antibiotics, or anti-inflammatories. We humans are terrible at calculating risk. We stay out of the ocean because we're afraid of sharks, yet we drive to the beach. Your rate of dying in a motor vehicle accident? 11 per 100,000. It's a similar rate of death from accidental falls. 2 people per year are killed by tigers in the United States. Statistically, that means you're more likely to end up like Carol Baskin's husband than you are to have a severe vaccine reaction. Vaccinate for yourself. Vaccinate for your family. Vaccinate for your community. Don't hold back society's reopening. Let's finish this fight against COVID-19. Thank you.
Thank you, Dr. Ranum. Appreciate that very much. And I was focused on you, and I missed what Molly was signing when 2 people per year were being killed by tigers in the U.S. So I wanted to see that again. But we again, Dr. Ranum said it so well. We can't stress enough how important everybody is about the awareness of the life-saving potential of the early application of monoclonal antibodies to reduce severe outcomes. And again, what this means is if you're so sick that you're now finally and perhaps stubbornly going to the emergency room, you may no longer be a candidate. We want to get these to you when your symptoms are mild. So if you're over 65 and you test positive, as Dr. Ranum said, our contact tracers are trying to notify people. The health website, Department of Health website has it, but there are steps for you to take to contact your health provider to see if you're eligible. But again, the combination of all 3 of these, the therapeutics, the vaccines, and the rapid tests, have us on a path right now, the beginning of the end of the pandemic. So next topic is commerce update. And the North Dakota Department of Commerce has completed 2 of the 3 resiliency grant programs. Economic Resiliency Grant received over 2,000 applications. They awarded $27 million to North Dakota businesses. The Hospitality Economic Resiliency Grant, designed to help business within the hospitality industry, received over 900 applications and awarded more than $23 million. And the Hospitality Economic Resiliency Grant Plus, which focused on businesses in the lodging sector, received close to 200 applications and awarded over $7 million. So that totals over $57 million going out through those 3 programs. These dollars are more important now than ever as businesses implement improvements that inspire customers to return to the marketplace and do that safely. And of course, these dollars were available through the coronavirus relief funds that the state was granted from the federal government. Watch for additional grant updates at ndresponse.gov or on the Commerce social media channels. As we have on each of our press briefings, we've taken a moment to talk about behavioral health, and we do know that beneath this pandemic, there continues to rage an epidemic, and that's the epidemic of the disease of addiction. And the behavioral health needs of all North Dakotans remain a key priority today, and we continue to address the challenges of COVID. But if you or someone you know is looking for addiction or mental health services, help is here. The best way for you to access that is at the behavioralhealth.nd.gov for information about free behavioral health services available to all, regardless of insurance coverage. Our behavioral health is just as important as our physical health, and we encourage all North Dakotans to reach out and take advantage of the many resources available to help those who might be struggling. As we close, as we do, with a gratitude quote, South African clergyman and human rights activist Bishop Desmond Tutu has stated, "It is far too easy to discourage, all too easy to criticize, to complain, and to rebuke. Let us try instead to see that even a small amount of good in a person and concentrate on that. Let us be quicker to praise than to find fault. Let us be quicker to thank others than to complain." And so as we close today, again, I want to thank all North Dakotans who have done and continue to exhibit the compassion and the empathy, the understanding, the thoughtfulness, and the love to their family, their friends, and their fellow citizens through all aspects of these trying times. We have 3 tools today that we did not have even months ago in the fall. And those tools of rapid testing, vaccines, and therapeutics. With these tools combined with local leadership and individual responsibility and the numbers that we're reporting today sets North Dakota up to do exactly what we intended from the beginning, which is to get through this together. We're in it together, and now we have an opportunity to finish strong and emerge stronger than ever. So thank you. Great job, North Dakota, and great job, everybody on the healthcare side, to put us in this position, and we look forward to continuing to move forward together. With that, we'll now stand for questions. Dr. Ranum and Molly are here to take your questions. First one up, we'll start here and work our way around. So, Jeremy, you're up first.
Governor, I'm wondering why you decided to allow the mask mandate to expire. What's the rationale behind that decision?
Well, I think we've coming at the end of an hour of data. Perhaps I'm hoping it would have been a little more clear that we've had, continued downward trends in all of the important numbers that we said we've been monitoring throughout, which include, starting with that first slide, and maybe we can pull that up again, but, the 80% drop in hospitalizations and the nearly 75%, the 75% drop in hospitalizations, 80% drop in confirmed cases, and a 75% drop in positivity rate. Those are among the things that we look at. And as I've said all along, it is not what government says, it's what people do. And there will be, and we hope to continue to see, the number of people wearing masks in North Dakota remain high. And so again, we're strongly encouraging masking protocols at the team level, the school level, the business level, the organization level. At every level, we encourage that. And we think that people in North Dakota now, when you've got a situation where if 1 in 8 North Dakotans have received it and virtually everybody knows somebody who's been seriously ill or died, I think people can have a clear understanding that individual responsibility can carry us from here. I trust North Dakotans to do the right thing going forward, and I'm confident that where we are and with the responsibility of North Dakota and local leadership at all levels, school district, city, county, department, coach, all those levels, that we're going to continue to see strong usage of masking and physical distancing going forward, but don't see the need to have either the emergency order related to the business restrictions or the mask mandate at a state level in place.
Do you believe that the mask mandate helped in slowing the spread here?
I think we've been asked this question before, and I think that it was one of a series of things in a multifactorial we've had great outcomes, and if you try to say where was there cause and causality in this, certainly I think everything played a part. At the heart of it is individuals and families and organizations helping to break the chain, greater awareness, greater compliance. The break in high school sports perhaps helped. People being smart over the holidays helped. The business community certainly helped. You just have to basically go back to any individual in the state of North Dakota that physically distanced, skipped a trip, wore a mask. They were all part of being part of that breaking the chain of transmission. So the credit really goes to everyone. But I think the science is settled. Masks can help slow the spread, and so for those who were wearing them, it was a positive contributor. And that science doesn't change when the mandate goes away. And so again, we strongly encourage people to continue to mask when you cannot physically distance. Okay, I'm going to go this way, and again, remind me your name, please.
Nelson with the Bismarck Tribune. My question is, has any person or business been cited for violating a mask mandate or business capacity restriction?
They may have, but I'm not aware of that because that would have happened at a local level. Maybe somebody on my team or somebody else has got that reference, but I don't know that offhand, Sam. Thanks. Morgan?
This is going off of Jeremy's question just a little bit more, looking into the future. As we see this expire on Monday, are you concerned at all about people maybe taking this as kind of just a free-for-all and maybe places getting more crowded? And what would it take in case our numbers started climbing back up for you to maybe reenact it?
Well, this is a risk, because in the end of the day, this is all based on individuals making decisions about their own perception of risk. And I think the thing I would want to point all North Dakotans to is that, our numbers are great. The nation's numbers are not. I mean, we're statistically, in terms of hospitalizations, cases, and deaths, the nation is more in the throes of the pandemic today than it ever has been. And we're in a very unique situation to be in a position to be, relaxing some protocols when everybody else is going the other way. But I think we know that there is fatigue that sets in for some people in terms of compliance fatigue, and perhaps this is a chance for us to take a breather. We hope that we don't, see a surge in February or March as some are predicting, but whether we do or we don't will depend a little bit on whether the citizens of North Dakota remain vigilant. If they're traveling to Florida, Arizona, and returning, be smart about it. We've got, again, know your status. We would encourage everybody to, if they feel a need to know their status. We've got such widespread free surveillance testing going on. This is another way to break the chain. I mean, we've got every day we've got people that are asymptomatic that show up at one of our free surveillance testing sites and go, hey, I was going to go visit my grandmother. Hey, I was going to go to a family event. Hey, I was going to go to a wedding. Hey, I was going to go on a trip. I just thought I'd get checked. I feel fine. Boom, they find out that they've got COVID. I mean, they're doing a great service by being part of that. And so there's lots of ways where people can be part of the solution here going forward. And I hope that people just maintain the awareness that we are still in the middle of a national pandemic emergency, and we should take our positive position with a dose of gratitude, but with also a dose of reality that the virus could come back as quickly as it left. And so that's something that we will continue to monitor, and we will continue to make sure that we're doing everything, working with the local leaders to make sure we're keeping our citizens safe. But again, the numbers we're at today, we haven't been this low really since August or September, but three things we have today we did not have before. We've got vaccines. We're racing to get as many of those in arms as possible, and hopefully the supplies of vaccine will continue to increase. But 2-3 months from now, if we've got everybody 75 and over, then everybody 65 and over, that could really reduce the risk of death, and that would allow us, as we are today, taking a little more transmission risk with students and other things that are coming back. But we're trying to balance all of these things, lives and livelihoods. The therapeutics you heard from Dr. Ranum, I mean, again, that is something that could really drive hospitalizations down and deaths down. So again, really could use all of the media's help on run stories, interview people, talk to people who's avoided hospitalization. I mean, this is a really powerful story that hasn't really been reported yet, and there's great stories here in North Dakota. And then, of course, again, helping keep the word out on testing. If people can, the surveillance testing is to give us a head start of understanding that if it's coming back or the new virus is coming back in a way where it's more transmission, we want to be part of being vigilant is not having our testing numbers drop, so that we can be aware when it does pop up that we can take the steps perhaps locally to contain it. And we love to contain things locally or in an institution as opposed to having to do things on a statewide level. Okay, I'm going to go to John in the back, or no, Shane. Lane, God, I'm so sorry.
I debated grabbing my name card, but I thought you might have had it down by now.
I actually had it down by now. I'm really embarrassed, but I was going to call you Paul Bunyan. He's sporting the red plaid today, but we're okay. Lane, thank you for being here, doing double duty, camera and questions.
I have a question for Molly.
Thank you, Lane, for asking a question of Molly Howell. Here she comes.
Yes, Lane.
So Molly, after somebody gets the second dosage of the vaccine, are they still able to carry and transmit the virus to other people, or does that kind of cancel it out after they get the second dosage?
Well, after you have 2 doses of COVID-19 vaccine, or in the clinical trials, after people had 2 doses of COVID-19 vaccine, about 94 to 95% of those individuals were protected from symptoms of COVID-19. And so, meaning they didn't have actual symptoms or disease. For the vast majority of clinical trial participants, they weren't routinely tested. And so it's still somewhat unknown if you can still have asymptomatic infection. However, there was a small subset of people in the Moderna trial where they did test them, and it showed to reduce asymptomatic infections by 2/3, but it was a very small group, and they didn't apply to the FDA to be authorized for that use. And so, because we're scientists, we can't say for sure, but most likely it probably will, but we just can't say that yet. But you are very unlikely to have symptoms of COVID, and especially unlikely to have severe COVID after receiving 2 doses of the vaccine.
So you're unable to spread it to others then as well?
If you're infected with COVID, you could potentially spread it, but you're less likely to have symptoms of COVID. But having the vaccine itself, the vaccine's not a live virus vaccine, so it's not giving you COVID, or it's not a weakened virus of the COVID, and so you're not able to spread, vaccine virus or anything like that from the COVID-19 vaccine. Oh my, okay. Go ahead.
James McPherson with the AP. The feds recently said they would release a bunch more vaccine, and now it appears they have none to release. The cupboard is bare. It seems like this might be another example of incompetence, bumbling, or worse. Has this created any problems for us in distributing vaccine?
Well, each week we're allocated doses of COVID-19 vaccine from the federal government, and we only know the week prior how many doses we're going to have the following week. And so it has been less than 10,000 doses per week. And so we've still been planning on just that, less than 10,000 doses per week. I do understand that of what was released this week by HHS, and that there would be a release of a bunch of second doses potentially, but we had not yet received any increase in our allocation or anything like that, so it hasn't really changed our planning. We're really planning around that 10,000 doses per week until we receive notification that our allocation has increased. Jeremy?
At the rate that the state is receiving doses at this point, when do you expect to get to phase 1C?
I get asked quite a bit on timelines, and it's really hard for me to estimate when we'll get to certain priority groups. It's if we continue to receive 10,000 doses per week, and I said there's 230,000 people in phase 1B alone. So, with math, you can kind of see it'll take quite a while, but I don't know what uptake is, meaning I don't know how many people in phase 1B are going to accept the vaccine. Based on the number of calls we're getting to the health department, I'm thinking it's fairly high, especially in our elderly population, but it's just hard to give an exact timeline, not knowing how many people are going to accept the vaccine. Sam?
Has there been any indication of when the federal government will start increasing allocation to North Dakota? I heard that states that distribute vaccine more quickly are more likely to get larger dose allocations.
Yeah, this week, Health and Human Services did state that in a couple weeks, they would start allocating to states based on the pace of their administration, meaning that if states are not administering doses, they're not going to continue to, allocate doses to those states. And so if that was the case, based on how well providers are doing at administering doses, North Dakota should fare well then if that's what happens. But I will say there's some unknowns there with President-elect Biden coming into office next week, if he's going to consider, similar policies as to the current administration. I don't think we know that for sure yet. Yep.
Tom Simon Willison, Trending Topics. President-elect Biden today promised 100 federal vaccination centers by the end of his first month. Do you know how many and where these centers may be in North Dakota? And then secondly, in Western North Dakota, people have had trouble getting on a list. Is there a list, and how can they get on it?
Yeah, so on the first question, I'm not aware of 100 federal vaccination centers, and so I'm assuming there will be more information forthcoming on that, and that would probably be if states need assistance in administering vaccine, which we have way more capacity. I mean, in normal flu vaccine season, last year we were able to give 45,000 doses in 1 week, and so if we had that much vaccine, we could definitely do it with our normal healthcare providers that we have in the state. In terms of a list, or getting on a list for vaccination, there's not a statewide list for vaccination, and it really is varying by local healthcare provider. Some do have lists, some don't. Some are using electronic medical records to notify you of when you're eligible for vaccination. Some are using local media or social media to post when vaccine's available. That's why I really encourage North Dakotans to look at our vaccine locator on our website, and it will specifically have instructions by provider site and let you know who has vaccine, who doesn't, which priority group they're currently vaccinating, and then it gives you directions based on what the providers told us they wanted their patients to do. And so I would take a look at that website, and that should give more information about how you can access COVID-19 vaccine. Any other? Sam?
How comparable is the rate of anaphylactic reaction in COVID vaccine to other vaccines?
Yeah, so the rate of anaphylaxis, according to CDC, after COVID vaccination is 11.1 cases per 1 million doses. For flu vaccine, it's about 1 per 1 million cases, or 1 per 1 million individuals vaccinated. And so it is a bit higher. But again, as Dr. Ranum said, as I mentioned, you have to put that in perspective as to what your risks are with COVID disease or what your risks are for things that you do in everyday life. Any other questions? No? Right.
Any questions for Dr. Ranum? Hands going up. Must have been a great presentation. He answered all the questions. Okay, we'll do a couple more. We'll go online. Danny?
Neil Carlson, iNews TV. We're hearing a lot of complaints about slow delivery of unemployment claims. Job Service has said they're waiting for more federal guidance. Is there a problem with getting the latest round of federal funds, or is there a problem with Job Service knowing how to disperse them?
There was additional benefits that were approved in the bill that happened just before Christmas, and as always, when they come up with those new requirements, it requires software changes for us to be able to determine eligibility and to write those checks. So I'd say it's a combination of both, because when that bill that's 6,500 pages was passed, it was not exactly clear if all the final regulations had been put in place in terms of the unemployment, additional unemployment benefits beyond what the state was already providing. And then also we knew that we had to do software changes to do that. And of course, as we've described, this is one place in the state where we have not just old technology, but ancient technology, an old mainframe. So it's not super easy to update. We've gone through a lot of that this year to keep those checks flowing. That group has done as well as any unemployment group in the country in terms of getting checks out to people. So I've got a lot of confidence in that team over there to navigate this new set of regulations and the changes that'll be taken. But again, there's of course you can call Job Service North Dakota, and if you're still having issues, feel free to call our office, and we'll dig into them and see if we can try to help on that front. Back to Jeremy.
Governor, you say that the state is accepting some level of risk back by taking today's actions, allowing the mask mandate to expire and turning the business restrictions into guidelines. The financial cost to business owners is evident of restricting businesses, but you've said that the cost of masks is really efficient, it's fiscally conservative. I'm wondering if you can tell me what is the cost of requiring masks and how did that play into your decision today?
Well, I think the additional transmission risk that I'm referring to is really about college students coming back and K-12 getting back to in-person learning. Those are, places where we would see just mathematically when you've got that many people interacting in buildings where we have more risk. So that's what I was referring to. It's again back to what people do. I mean, we can let the mask mandate expire on Monday, and on Tuesday, more people could wake up and decide to wear a mask than ever before. I mean, they just choose to do that because there's so it's really impossible to calibrate what the mask usage will be, and we know that we had mask usages, with or without the mandate, and we know that it didn't go to 100% with it. We know that it may go down some when it goes away. It may not go down. Again, when you look at the national studies on this, local mask mandates had a higher response of compliance than state ones did, and so we have every opportunity to continue to do a great job on mitigation protocols without it. But again, that comes back to individuals executing individual responsibility to do that, or individuals, or teams, or schools, or businesses. Anybody that wants to say, let's be part of the solution till the vaccines are done, and let's keep our customers safe, let's keep our classmates safe, let's keep our elderly and vulnerable safe. I mean, there's so many reasons to do it, and plenty of reasons to do it. And I think those reasons are all more powerful and all more meaningful than anything that government can say. So I feel that there's powerful motivations in place for us to continue to do a great job, because I said this is the path towards being normal is everybody doing this, and then doing the three things we've talked about: surveillance testing, monoclonal antibodies on the therapeutics, and the vaccine. Those three things. I mean, we've actually got three tools we didn't have before, and let's go finish strong.
But allowing the mandate to expire, is that a consideration for personal freedoms, principally?
Well, I think we've all along had a approach where we said that individual responsibility mattered more. It's more what people do than government say. So I'd say it's consistent with what we were saying since the very beginning of this, at the very beginning of the pandemic. Danny?
One more for Molly.
Molly, come on back up.
CRISPR point of view. 23 people died in Norway within days of receiving their first dose of the Pfizer vaccine, with 13 of those deaths, all nursing home patients, apparently related to side effects of the shots. According to health officials, can you tell us more about this situation, if you know?
I can only say what I've seen in the media. I read the same report earlier this afternoon. I do want to say, though, from what I saw, most of them were in long-term care residents. And long-term care residents generally have poorer health and are more likely to die just in general, unfortunately. And so if you're focusing on vaccinating long-term care residents, then it's likely there may be some long-term care residents that die after being vaccinated, not necessarily due to the vaccine, but just as a coincidence, as there's a higher death rate in long-term cares. And so I would need more information. I'm sure they're going to investigate it. We haven't seen that in the United States, but all I'm aware of is what the media is reporting. Any other questions? Okay.
Okay, thank you, Molly. Thank you, Dr. Ranum, and thank you all of the loyal members of the press who are here once again. Thank you. Thank you, Lindsay. Thanks, Department of Health, for hosting. And at this point, we don't have an update of when our next press briefing will be, but we'll keep you posted. But again, thanks for your help in helping get the word out about safe vaccines, life-saving therapeutics, and the availability of rapid testing to help us navigate through and to see the finish of this pandemic. So, and again, I want to close by saying thank you to all North Dakotans who've been doing a great job that helped us be in this position today, which is really in a strong position relative to the rest of the nation. Let's keep up the great work. Thank you very much.